Hello, this is Emily,
Nick,
and Brady.
and this is our World Health Project.
Today we will be talking about the epidemiological transition stages and how they play a factor in world health.
There are currently no countries in Stage 1, but if there were, this is what they would look like. These countries would have a high CDR, distinct health threats, and would be filled with infectious and parasitic diseases.
a region containing Stage 2 countries is Sub-Saharan Africa. AIDS is a pandemic in Sub-Saharan Africa and is negatively impacting the population. These countries have a rapidly declining CDR and contain many infectious diseases. In this region, there is an average 1 physician for every 1,000 people, as well as an average 1 hospital bed per 1,000 people. The expenditure of countries in this area is 5 to 6%, and private healthcare funding in Sub-Saharan Africa is 50%.
An example of a Stage 3 country is Poland. They have a moderately declining CDR, a large decrease in infectious disease deaths, and an increase in chronic disorders associated with aging. Poland has an expenditure rate of 6.4% of their GDP. There are 4.6 hospital beds per 1,000 people and 2.2 physicians per 1,000 people. A majority of people use both public and private health care, and very few only use private.
The United States is an example of a Stage 4 region. It is characterized by a low but increasing CDR, a low infant mortality rate, and people die of cardiovascular disease and cancer instead of infectious diseases. The United States has 2.3 physicians per 1,000 people, and there are 3.3 hospital beds per 1,000 people. The expenditure rate is 11.5%, and there is an 8.8 private health care rate.
Geographers disagree on whether or not Stage 5 actually exists. However, Japan is a good example for those who do believe it exists. Japan has many infectious diseases, the birth rate is higher than the death rate, and globalization has led to the creation of this stage. They have 14.3 hospital beds per 1,000 people and 2 physicians per 1,000 people. The expenditure in Japan is 30%, and roughly 26% of this is private healthcare funding.
On the World Health standpoint, we agree with the possible list. This is because humans would realize they're running out of resources and would be able to adapt to this and preserve the resources, and maybe even create technology to make these resources that are non-renewable into renewable resources.